My name is Sumit Tapu. I'm the director of Sai Prema Foundation Fiji, and very blessed to have the opportunity to to do what we're doing. I'm a singer by profession, and not many singers have the opportunity to build a hospital. Inspired by the teachings of Sri Sathya Sai Baba and under the direct guidance of Sadguru Sri Madhusudan Sai, Sai Prema Foundation was born in 2016.
It was in May 2014 that Sadguru Madhusudan Sai made a mention that the Sri Sathya Sai Sanjeevani Child Heart Hospital, which had commenced services in Naya Raipur in Chhattisgarh, would grow into a very large global institution of healthcare, rendering totally free of cost services to the unserved populations of the world.
When Sadhguru came in September 2015, and then soon after he gave us directions to start off helping the poor and needy in Fiji, and we could see that his emphasis was on medical care.
The partnership with the Sri Sathya Sai Sanjeevani Hospitals India gave us the ability, the capability to dream of such a facility which would treat our children.
Right from the beginning, we knew that we were going to build a medical center, then we were going to build the heart screening center, and we started screening children. But once you screen children and you tell the parents either the good news or the bad news, you tell them, your child has got a heart disease, then where does he go then?
Approximately 200 children are born in Fiji every year with congenital heart disease. Without access to surgical intervention, most are doomed to live very short lives of immense suffering.
So we thought we can't wait for 5 or 10 years, we need to do something sooner.
So we approached the government and we spelled out our intentions, and they took it on board very positively, and they made this land available.
We understood back then the critical need in Fiji for a specialized children's hospital.
It hasn't been easy. I think it's been challenging at multiple levels, I'd say.
There were days where we just didn't know what to do. Every consultant told me, "You're mad. Do you even know what we're doing here? Do you know you know nothing about engineering, you know nothing about building. You don't know what's going to happen." No idea, I'm telling you right now. How are we going to finish this project?
And some days we just didn't know how we were going to pay these contractors. And we just felt terrible that we had to build this hospital, we had to get equipment, but we were challenged with finances.
Not having the ability to immediately pay somebody, pushing people to work 24 hours a day. And the experiences on site, you get sworn at. Someone came to me and said, "What is your rush? Why do you want to build this tomorrow morning?" I mean, you have to understand, and we're building a building here. It's not cooking a curry. He gave me a 10-minute lecture. And in the 10 minutes, you pray for guidance. The 10 minutes, all I was doing was just saying, what can I say to him to make him realize? I kept thinking, please help me, please help me. So after his 10-minute, lecture to me, telling me about what a fool I was, I said, "Have you finished?" And he looked at me surprised, and he said, "Yeah." I said, "What if it was your child? Would you wait a day? What if it was your child?" And it was the perfect response. Because from the next day, the whole team was here. And they worked hard. Then COVID comes.
Borders were closed. We couldn't bring a lot of equipment in. We had issues bringing our biomedical engineers. We had issues with medical gases because, our technicians had to come from New Zealand and the borders were shut.
So you already have something which you're trying to build, which is near impossible, in an impossible time frame. And then you have a nightmare of a situation where you can't have all the workers on site. So instead of having 100 people on site, you have 10. We could have said, it's COVID. Let's just wait for COVID to get over. But we didn't do that. The children dying. The kids dying. So many children who were screened for, who had heart disease, they passed away in front of our eyes. So could we delay? No.
In March 2016, I tried to organize for Dr. Ashish Katewa. He was the surgeon at the Raipur hospital to come in August and operate. And at that time, we were operating at the main public hospital here, the CWM hospital.
I went into the hospital to give a gift of life certificate to a child. I walked into the ward. I was shocked that after 5 days of open heart surgery, a cut this big, the child is looking normal, playing like any other child. Picked the child up, called his mum, held the certificate up, took a photograph. She teared up and she said, yes, Jesus answered my prayers. And she put her head on my shoulder and she was weeping. I said, tell me a story. And what she told me changed my life. She said, I'm a single mom, no family support around me, earns $5,000 a year. When the child was 1 year old, the doctors told the mother the child had a hole in the heart. And she said, okay, you can operate on the child. And they said, no, there's nothing available in Fiji. You have to go overseas for treatment. And she said, okay, she said, you can send the child overseas. They said, no, you'll have to, there's no provision right now. You'll have to do this on your own. And she asked them how much will it cost, and I said approximately $100,000. So she said, I started asking around for money. She collected $1,500, $1,500. There's a long way away from $100,000. And she said, I resigned to the fact that nothing can happen now. So she said, well, I went back to my village. And, wait for my son to die. I've got 2 young children as well. That's what changed my life. Because it wasn't about, because Sadguru said to build a hospital, I had to build a hospital. It was because I wanted to do it. How can this be happening in my country? How can a mother who wants to save their child not be able to do it because of commerce, because she can't afford it?
In a world where healthcare is predominantly driven by economic forces, the concept of delivering anything free of cost was undoubtedly alien and possibly questionable.
Creating awareness, I think, is really important as well. People know that this hospital has no billing counter. All the services are free.
People around the world, when they hear about that model, they wonder how it is sustainable.
When you become a free of cost, no agenda institution, you start attracting very many people to come and work with you.
I think the more people find out about the hospital, they also realize that they want to contribute. And so we did a partnership with the Pacific community, this SPC, the South Pacific Commission.
The Sai Prema Foundation has signed collaborative partnerships with UNDP, with the Fiji Red Cross, Consumer Council of Fiji, Digicel, with so many NGOs, with universities. And now it's become like this sugar mountain where it's attracting everybody. Why? Because we just want to do good. There's no other motivation.
Rendering services has now commenced, a surgical mission led by the remarkable surgeon Dr. Sean Sethi from the United States, a key member of the Sathya Sai Sanjeevani global mission.
It's a really amazing experience to see these children being operated on. And I feel very privileged to be able to go in the operating theatre and actually witness the surgeries happening. Dr. Sean Sethi's here from the US, and he's an incredible surgeon.
You spend a lot of your life training to get to this point, and at the end of it, I think you want to do something good. So with the Sanjeevani system, when the first hospital came up, I was actually the first surgeon to go do a mission trip in Raipur, and that just kind of kick-started a lot of things.
It's the first hospital in Fiji built to international standards. And we say this very proudly, with a lot of humility.
Coming to this hospital and working here, it's like working in any other tertiary care hospital in the West.
When arriving to see that heart and going like that, the entrance, it was more than my expectations as to what the beauty of this hospital is.
It's a beautiful hospital. The way it's set up, it's really tailored to the patient with a heart issue. Everything's close by. The operating room is right next to the cath lab, which is right next to the ICU.
And I said, please forgive us for any areas which is not up to your standard. And they said, no, we're dying to come back. Please call us again. That brought tears to my eyes.
As I was going through the hospital, it's indescribable how I felt. The power of that love became stronger. Then pretty soon, a little tear. And towards the end, I started to cry. True crying, not just a little bit. I couldn't stop all the way out to the end.
So the patients have done really well, and it's actually nice to see them getting better so quickly.
The Fijian kids, even with all the pain, they don't cry much. I think they are amazing kids.
If you're thinking about the emotional aspects of it, you're never going to get through one case. So it's not until after that you kind of think about it a little bit more. So something like the Gift of Life ceremony, that's when you kind of feel happy for them.
It was amazing to see those kids who were operated on 2 days ago running around like nothing had happened to them, full of energy.
And I know the birth pangs that Sai Prema Foundation had to undergo to give birth to this beautiful hospital. But all that labor of love was worth it when today this hospital stands to serve the children of Fiji and South Pacific.
The ultimate solution, the long-term plan, is to train the local medical professionals, so that we can have our local team here in Fiji. But that's going to take time. It's going to take up to 5 years or even more.
But till then, we have incredible support from India, from USA, Australia, Singapore, Malaysia, UK, Canada, New Zealand. All these incredible nations who will send these miracle workers, like I call them, to save these children's lives. Sadhguru is the mission that he's embarked upon. It's phenomenal. unfathomable.
And therefore, it's our vision to see to that education, health, and nutrition are fundamental rights given to all the children of the world. I definitely don't hope that the whole world will have children who will be born without any diseases. It may not be possible. There are natural laws governing health and childbirths. But definitely we can create a world where every child has access to healthcare and nobody is denied healthcare for want of money.
Sadhguru was talking, he was explaining, he said, how can you measure goodness? How can you measure a life saved? The monetary value, okay, they've saved $100,000. That's one aspect of it. But how do you measure the happiness of a mother? And how do you measure that child getting inspired to do good in society, who may become the Prime Minister of this nation one day? So what's happening here is this miracle of life which will snowball into this tsunami of love which no one can ever measure, but the world will feel.